Many people tell me, "Doctor, my blood tests are completely normal." But when I look at their hands, I see a very different story unfolding today. Your liver may have been crying out for 2 years, and your heart has been sending signals every day. You just haven't learned their language yet. A normal test result doesn't always mean you are in the clear. Your body often whispers through your skin long before the lab results start screaming. Today, I will teach you how to read the health map on your own palms before the chemical markers in your blood have a chance to speak. The hands are a forgotten message from the body. They act as an early warning system that most people simply ignore until it is far too late. By the end of this video, you will look at your own hands in a way you never have before, discovering secrets about your internal health. Think of your hands as the ultimate dashboard. They reflect the inner workings of your most vital organs with incredible precision and surprising speed. Your liver and your heart are constantly communicating. The hands are where their most urgent messages often arrive first for those who know how to look. Let us begin this journey of discovery. We will decode the silent signals of your body, starting with why the hands are such a powerful biological radar. Why the hands? Because they house one of the densest networks of capillaries and nerve endings in the entire human body, reacting to every internal change. Any change in blood pressure from the heart or a buildup of toxins from the liver causes these tiny vessels to dilate and change their appearance. When the liver fails to metabolize hormones or toxins, the overflow creates a visible reaction in the hands, long before you feel any physical pain. This is not palmistry or fortune-telling. This is pure biology. It is the science of perfusion and the immediate physical response to internal endocrine changes. Your fingertips are like the end of a long plumbing system. If there is a problem at the central pump, the pressure shows up here first. If your heart isn't pumping efficiently, the oxygen levels at your finger's edge will drop, causing the tissue to change shape and color very subtly. The speed at which color returns to your nails is a direct window into your cardiovascular health and how well your blood is moving right now. When the liver is overwhelmed, hormones like estrogen can accumulate. This excess causes the small blood vessels in your palms to widen, creating a red glow. Most doctors might miss these signs during a quick physical, but they are the keys to catching chronic diseases years before they become life-threatening emergencies. By observing these changes, you become an active participant in your own healthcare, learning to spot the red flags before the damage becomes irreversible. Let's look at a real-life example of how a simple observation of the palms saved a life, proving that the hands truly do speak the truth. Meet Maria, a 45-year-old patient who came to me thinking she had a simple skin allergy on her hands that wouldn't go away. Her palms were bright red, but not itchy or painful. She had what we call Palmar Erythema, often referred to as liver palms in medical circles. Instead of prescribing a skin cream, I ordered an immediate ultrasound of her liver. Maria was shocked, as she had no abdominal pain or jaundice. The results were clear: stage 3 fatty liver disease and the beginning of cirrhosis. Her body had been warning her through her hands for months. She didn't feel sick, but her hands were telling a story of internal struggle. Identifying this sign early allowed her to change her life before failure. Never ignore unexplained redness on your palms. If it stays red and feels warm, it's not just a skin issue. It's a message from deep inside. Maria also had these small marks called spider angiomas. They look like tiny red spiders on the skin and are classic signs of liver distress. The redness is usually found on the outer edges of the palm. If you press it, it turns white, then quickly turns bright red again immediately. Today, Maria is healthy because she listened to her hands. Her story is a powerful reminder that our skin is the mirror of our internal organs. You might have similar signs right now. Don't panic, but do pay attention. Let's dive deeper into the specific liver signals you can check today. We are moving from general redness to the very specific details of your nails and skin that point directly to how your liver is functioning. The first major sign is known as Terry's nails. This is when most of the nail looks white, like ground glass, with a dark band. In Terry's nails, the natural pink color is gone because the liver is no longer producing enough albumin, a vital protein for your blood vessels. When albumin levels drop, the blood supply to the nail bed changes, creating that characteristic white, washed-out appearance that signals chronic liver disease or failure. Next are the spider angiomas. If you see these tiny red spiders on your hands or chest, it means your liver is struggling with hormone balance. These appear because the liver can't break down estrogen, causing tiny surface arteries to dilate. They are a classic red flag for liver scarring or cirrhosis. Look for a yellow tint in the creases of your palms. This can be an early sign of jaundice, where bilirubin builds up in your skin tissues. Bilirubin is a waste product. When the liver's filter is clogged, this yellow pigment leaks into your skin, often showing up in the hands very early. Chronic itching on the palms that doesn't go away with lotion can also indicate bile salts are backing up in your bloodstream due to liver issues. A thickening of the tissue in the palm, making it hard to straighten your fingers, is sometimes linked to alcoholic liver disease and metabolic issues. A specific flapping tremor of the hands, called asterixis, is a very serious sign that the liver is failing to clear toxins from your brain system. This happens when ammonia builds up. It's a late-stage signal, but knowing it can save a life by getting someone to the emergency room immediately. Your liver is a silent worker, but its distress is written all over your hands. Now, let's switch focus to the pump of life, your heart. The heart and lungs work together to oxygenate your blood. When they struggle, the very shape of your fingers begins to change in a strange way. This is called clubbing. The tips of the fingers become enlarged and the nails curve over the edge, losing their natural angle and becoming very soft. Try the Shamroth test. Press your 2 index fingernails together. If you don't see a tiny diamond-shaped window of light, your fingers are likely clubbing. Clubbing is a sign of chronic low blood oxygen, often caused by heart defects or lung disease. It is the body's way of trying to survive. Next, look for splinter hemorrhages. These look like tiny reddish-brown lines under your nails, appearing vertically like a small wood splinter stuck in the skin. These are actually tiny blood clots or damaged capillaries. They can be a sign of endocarditis, an infection of the heart valves that is very dangerous. If you notice painful, red bumps on your fingertips, these are called Osler nodes. They are another critical warning sign of a serious heart valve infection. Janeway lesions are similar, but flat and painless on the palm. Both are signs that bacteria from the heart are traveling through your entire bloodstream. If you see these spots, don't wait for a checkup. These are medical emergencies that require immediate attention to protect your heart from permanent damage. The color of your nails can also turn slightly blue, a condition called cyanosis. This means your heart isn't getting enough oxygen to your extremities. Are your hands always cold, even when it's warm? This could be a sign that your heart is struggling to pump blood effectively to your limbs. The strength and rhythm of the pulse at your wrist can also be easily felt, giving you a real-time report on your heart's health and rhythm. These heart signals are your body's way of asking for help. Now that you know what to look for, let's do a live check together. I want you to stop being a passive viewer. Place your hands on a table under natural light right now, and let's examine them together. Step 1. Check the color. Are your palms unusually red or blotchy? Look at the edges near your thumb and pinky finger for any bright redness. Step 2. Look at your nails. Are they pink and healthy, or do they look white, yellow, or have strange dark lines running through them vertically? Step 3. The refill test. Press firmly on your fingernail for 3 seconds until it turns white. Release it and count how long it takes to pink. If it takes more than 2 seconds for the color to return, your circulation system is struggling. This is a very simple but powerful health indicator. Step 4. Temperature check. Do your palms feel feverishly hot without a fever, or are they icy cold despite the warm weather around you today? Step 5. Texture and swelling. Look for any unusual puffiness in your fingers or thickening of the skin that makes your hands feel stiff or tight. Don't be afraid if you see something. Be grateful that you noticed it today. This knowledge is your power to take action before symptoms become severe. Write down what you see. Take a clear photo in good lighting. This will be invaluable information for your healthcare provider during your next consultation. By catching these signs now, you are giving your organs a chance to heal. Most liver and heart issues are manageable if caught in the early stages. I am not here to scare you. I am here to wake you up to the incredible language your body uses every single second of every day. Now, let's talk about the specific scientific tests you should ask for if you found any of these signs on your own hands today. If your palms are red or nails are white, ask for a complete liver function panel, including AST, ALT, and GGT, to check for enzyme levels. For heart signs like clubbing or blue nails, an EKG and an echocardiogram are essential to see how your heart is pumping and its structure. Tests are the final word, but your hands are the first whisper. Don't wait for the blood test to be the siren that wakes you up. Your health is a journey of listening. Your body never lies. It only waits for you to finally pay attention to what it is saying. Share this knowledge with your loved ones. Look at their hands too. You might just spot something that saves a life in your own family. Thank you for joining me today. Stay curious, stay observant, and most importantly, stay healthy by looking down at your hands once in a while. I am here to guide you. Subscribe.